Welcome to The Explainer. Today, we're diving into what might just be the most intense and incredible period in a person's life, the first 72 hours. We've taken some super detailed nursing school notes, and we're going to use them to tell the amazing story of a newborn's arrival and a mother's recovery. Let's get into it. So, to really set the stage for this whole journey, I want to start with a big question. Think about it. Across your entire life, from beginning to end, what do you think is the single most critical 60 minutes? While the answer is the very first hour after you're born. It's a period that's so vital, it's actually known as the golden hour. And let me tell you, this is not a time for quiet cuddles and photos. Nope. It is a high-stakes, all-hands-on-deck race against the clock, where a whole bunch of life-saving stuff has to happen, like right now. Okay, so this right here, this is basically the playbook for that race. Step 1, clear the airway. And there's a specific order, mouth first, then nose, so the baby doesn't accidentally gasp and inhale fluids. Next up, you gotta get them warm, immediately. Think about it, newborns can't shiver, so they can't regulate their own temperature. Then the checklist just keeps going. A shot of vitamin K to stop any dangerous bleeding, some eye ointment to prevent infection, security bands for mom and baby, and of course, getting that first feeding started. And all of this has to happen within that 1-hour window. It's a lot. And that whole warmth thing? This is why it's so high on the list. This little nursing school saying is just brilliant. A cold baby is a baby in distress. See, being cold isn't just about feeling chilly. For a newborn, it kicks off this really dangerous chain reaction. Their little body starts burning through all its sugar stores just trying to stay warm, which leads to low blood sugar. And that makes them need way more oxygen, which can spiral into serious breathing problems. It all happens so fast. Now, at the same time all of this is going down, the baby is getting their first ever test, kind of like their first report card. It's called the APGAR score. It's this super quick checkup that happens at 1 minute and then again at 5 minutes after birth. And it gives the medical team a really fast snapshot of the baby's overall health. And the name APGAR is actually a mnemonic, which is pretty clever. It stands for activity, pulse, grimace, appearance, and respirations. Each one of those things gets a score from 0 to 2. It's just a really simple, really effective way to see how well the baby is handling the massive change of being out in the world. All right, so once that frantic, life-saving golden hour is over and things have calmed down a little bit, the pace changes. Now it's time for a much more careful, really detailed, full head-to-toe checkup of the newborn. And this is where some real clinical detective work kicks in. I mean, look at this. A bump on a baby's head isn't just a bump. You have to figure out what kind it is. Is it a caput? That's just some soft swelling from pressure that goes across the skull's suture lines and usually fades in a few days. Or is it a cephalohematoma? That's a collection of blood, it feels firmer, and this is the key clue, it does not cross those suture lines. And that one's more serious because it can increase the risk for jaundice. See? Every little detail tells a story. Okay, the baby's stable, they've had their first big checkup, now the focus shifts to being proactive. It's all about building a safety net to protect them, using a few standard medications, and some really important health screenings. So what's in this safety net? Well, it's basically 3 key things. First, there's that vitamin K shot we talked about earlier, super important for helping their blood clot properly. Then they get their first dose of the hepatitis B vaccine. And finally, a little bit of erythromycin ointment is put in their eyes to prevent any nasty infections they might have picked up on their way out. You know, for any new parent, probably the most common question you hear them whisper in the hospital is this normal? So let's take a minute and decode some of the totally common and sometimes kind of weird-looking things you might see on a brand new baby. Yeah, a lot of things that might look a little alarming at first are actually completely harmless and they'll go away on their own. Like those tiny little white bumps on their nose, totally normal, that's called milia. That bluish-gray spot on their lower back, that's a Mongolian spot, also normal. See a splotchy rash that comes and goes? Probably just erythema toxicum, a classic newborn rash. And that, well, cheesy white stuff all over their skin? That's called vernix. And it's basically the best natural lotion you could ever imagine. It's great for their skin. Okay, so while all of this incredible energy and attention is focused on the baby, we have to remember there's a whole other journey happening at the exact same time. It's the mother's recovery and assessment. And this is every bit as critical, but honestly, it's something we don't talk about nearly enough. So to make sure absolutely nothing gets missed during this really important recovery period, healthcare providers have a super systematic way of checking everything. And just like with the baby's APGAR score, they use a pretty clever mnemonic to remember it all. And that memory hack is the acronym BUBBLE. It's a bit of a mouthful, but each letter stands for something they have to check. Breasts, uterus, bladder, bowels, lochia, episiotomy, legs, and emotional state. And for every single one of those, the nurse is looking for specific signs that things are going well, like a nice firm uterus, while also being on high alert for any red flags like a boggy uterus, which could mean big trouble. And that U for uterus in the BUBBLE check, well, that brings us to the single most serious and frankly most feared complication of childbirth, postpartum hemorrhage. So what exactly is a postpartum hemorrhage, or PPH? The clinical definition is losing more than 1,000 milliliters of blood. To give you an idea of what that looks like, think of one of those big 1-liter cartons of water or milk. Losing that much blood is a life-threatening emergency. It is the #1 cause of maternal death around the world, and you have to act and act fast. Now, to stop the bleeding, you first have to know why it's happening. And to figure that out quickly, clinicians use another great mnemonic, the 4 T's. Most of the time, the problem is tone. The uterus just isn't contracting like it should. But it could also be from trauma, like a tear. Tissue, meaning a piece of the placenta was left behind. Or thrombin, which is a clotting problem. You gotta know the why to know how to fix it. The very first response is incredibly direct and, well, physical. The #1 top priority first thing you do is something called a fundal massage. This is where a nurse literally uses their hands on the outside of the abdomen to firmly massage the uterus, physically forcing it to contract and clamp down on those bleeding blood vessels. It's totally low-tech, but it is a high-impact, life-saving move. Okay, but what if the massage isn't enough? That's when they bring out the big guns, a whole toolkit of powerful medications. But this is not a one-size-fits-all situation. You have to be so careful. For example, a drug called methergine works really well, but you absolutely cannot give it to someone with high blood pressure. Another one, hemabate, is a great option unless the patient has asthma. So choosing the right drug means you have to know that patient's medical history inside and out. And that brings us to the end of our explainer. It's just incredible, right? From the baby's intense race against the clock in that golden hour to the mom's super systematic BUBBLE check, these first 72 hours are just this whirlwind of constant, careful assessment and life-saving actions, which really leaves us with this final, powerful question to think about. In our world of super high-tech medicine, how is it that a simple physical massage can still be the single most critical first step in saving a new mother's life? It's just a great reminder that sometimes the most basic, fundamental, hands-on things we do are also the most powerful. Thanks for watching.